Hello and welcome to our training video. My name is Martin E. and I work with HUD's Office of Lead Hazard Control and Healthy Homes. This video is going to review the background and cover the major changes that have recently been made to the Lead Safe Housing Rule. We hope the video will be useful to you as a technical resource as you implement the amended rule and further protect children from the dangers of lead poisoning. Lead poisoning has long been known to create major health problems for children. It can cause physical problems, including stunted growth, kidney damage, speech and hearing impairments, and neurological problems, including reduced intelligence, low attention span, and reading and learning disabilities. It has also been linked to behavioral problems and juvenile delinquency. As we will hear in a moment, these mental and physical issues usually show up long after the exposure and the damage is done. Although there are numerous potential sources of lead hazards like contaminated water, soils from old industrial sites, and products like imported candies, toys, crockery, and traditional medicines, the Center for Disease Control and Prevention has affirmed its position that lead-based paint and associated lead-contaminated dust are the most common sources of lead exposure for U.S. children. Over the past 2 decades, HUD has kept track of a dramatic reduction in housing-based lead exposure among children through lead paint testing, abatement, and interim controls in federally supported housing. Nevertheless, it is important that all of us continue to closely follow the regulations and guidance to protect our children. Before we get into the particulars of the rule, let's visit with 2 doctors on the front lines in the battle against childhood lead poisoning and find out why it's so important to protect our kids from exposure to lead. We're here at the Connecticut Children's Health Center in Hartford, Connecticut, to talk to Doctors Tricia Garcia and Jennifer Hale about the importance of testing your child for elevated blood lead levels. Let's go see Doctors Garcia and Hale. We asked the doctors about their practice with children, how lead poisoning could impact their patients, and what impact the new lead poisoning standard would have. We also asked about other lead hazards that could harm kids, and we're surprised at some of their answers.
So our pediatric practice, the Hartford Lead Regional Treatment Center, currently has 179 patients with lead levels from 5 and up, and we see children of all ages who are lead poisoned from the top half of Connecticut.
So the current recommendations are to do 2 lead blood screenings between the ages of 9 months and 36 months. Routinely, most pediatricians' offices do them at 12 months and then again at 24 months. And the idea of that is to screen and catch these children with elevated lead levels before they start to have any signs of lead poisoning.
So I think that's one of the most important things for people to know about lead poisoning is that kids have no symptoms. You don't even know it's there. The long-term developmental outcomes with lead poisoning, we know that kids have difficulty reading, difficulty in school, but you may not see that till they're 7, 8, 9 years old. And by then, their lead level might have already gone down. And if you didn't catch it when they were younger, there's no way to trace it back to the poisoning.
The most important thing for us in seeing these children with blood lead levels of 5 and following these screening protocols is that we get to see them before the lead levels are very elevated. We all know no amount of lead is safe, and trying to identify where they're being exposed and reducing that exposure is very important.
We are very excited about this change. One of the biggest issues we've had is if the child's lead level is 5 or 6 or 7, the local health department, if they don't have the resources, can't go out into the home. I think that lead poisoning is an old problem, and it is viewed very much as a problem of the inner city or the past, and that's just not true in New England. Our housing stock is old, and if you live in an older home, you are exposed to lead. You are at risk. So our 2 biggest populations that we focus on are all the Hispanic communities, especially South America, Central America, but also South Asian communities, specifically people from India, Bangladesh, and Pakistan. These 2 communities have a lot of cultural items that will contain lead, including makeup, ceremonial powders, jewelry, candies, glazed pottery, toys. Even things like pressure cookers can sometimes have lead gaskets in them. So they're exposed from multiple sources that they might not be aware of.
Now that we know a bit more about the health reasoning behind this amendment, let's take a look at the specific elements of the rule that are changing. First off, this rule covers federally supported housing that was built before 1978. In the regulation, this is called target housing. When the rule was first adopted, HUD had set the response standard for a child with an elevated blood lead level test at one test of 20 micrograms per deciliter or two tests showing 15 micrograms per deciliter or greater taken 3 months apart. This followed the recommendations of CDC at that time, and in the original regulation was called an environmental intervention blood lead level. CDC has revised its guidance on blood lead levels, and now the old environmental intervention blood lead value will be replaced with an elevated blood lead level. This will require owners or designated parties managing federal housing programs to respond when there is a verified report of a child with a blood lead level equal to or above 5 micrograms per deciliter. In plain language, this change means that in older federally supported housing, a response is now required based on a significantly lower blood lead test result. To understand what is required for this response, let's break down the who, what, when, where, and how elements of the new rule. So who is responsible for responding to the report of an elevated blood lead level child living in a federally supported housing unit? The rule uses the term designated party to identify the person or entity responsible for compliance with the lead-safe housing rule. In project-based supported housing, like project-based Section 8, and/or multifamily housing with FHA insurance, the designated party is the owner of the property. In public housing, the designated party is the Public Housing Authority. In the mobile Section 8 housing program, where residents receive vouchers to support their rent in privately owned housing, the responsibilities for response to an elevated lead level are shared between the agency administrating the Section 8 voucher, usually but not always a Public Housing Authority, and the owner of the property. Lastly, in some cases, HUD itself is the designated party. This occurs when HUD is the mortgagee in possession of a multifamily property that was foreclosed. When is a response triggered to a report of a child with an elevated blood lead level? The rule states that a response is required when the designated party receives a report from a public health or medical health care provider of an elevated blood lead level. If the designated party receives the report from a person who is not a medical provider or agency, then they are responsible for immediately verifying the information with the health department or medical provider. This situation may be more complicated than it sounds, as patient confidentiality regulations are strict. If you are confronted by a situation where you cannot get confirmation of the elevated blood lead level report, you should contact the HUD Rental Assistance Program Manager, who will then make an effort to confirm the information. HUD's Office of Lead Hazard Control and Healthy Homes is a public health agency for purposes of receiving information regarding testing of blood lead levels and may be able to help. What response is required by the designated party when notified of a child with an elevated blood lead level? After you have confirmed the elevated blood lead level with the appropriate authority, within 15 days the designated party shall complete an environmental investigation of the dwelling unit and, if it is in a building with other dwelling units, the common areas servicing the child's unit. The procedures for an environmental investigation are described in Chapter 16 of the HUD Guidelines for the evaluation and control of lead-based paint hazards in housing. The environmental investigation will include comprehensive environmental sampling, interviews with the family, and coordination with case management, among other elements. The requirement to complete an environmental investigation shall not apply in cases where a public health department has evaluated the unit. Also, if after the child's blood was last sampled, the owner has already conducted a risk assessment of that unit, then only the elements of the environmental investigation not done during the risk assessment need to be completed. If the environmental investigation or evaluation report from the Public Health Department identifies lead-based paint hazards, then the designated party shall complete the reduction of identified paint hazards within 30 calendar days of the receipt of the report. Lead hazard reduction is complete when all of the lead-based paint hazards identified in the environmental investigation have been abated, received interim controls, and clearance is achieved, or a public health department has certified that the lead hazard reduction is complete. There are a couple of other steps required in the new regulation when the designated party receives notice of an elevated blood lead level at or above 5 micrograms per deciliter. If the environmental investigation conducted determines that there were lead-based paint hazards and there are other federally subsidized units of housing in the property with children less than 6 years of age living there or expected to live there, then the owner or designated party shall conduct a risk assessment in the units with these children. If that risk assessment identifies lead paint hazards, the owner or designated party shall remediate the hazards and conduct clearance testing. The time frame for completion of the risk assessment, remediation, and clearance testing will vary depending upon the number of units involved. There are 2 exceptions to the requirement for additional testing following the receipt of an environmental investigation, and we will review those in a moment. So to illustrate, an owner of a 3-unit property rents all of the units to households supported by the Section 8 Mobile Voucher Program. He receives a report of an elevated blood lead child on the first floor. He immediately informs the Housing Authority, who is the designated party for this requirement, and they verify the report with the Health Department or medical provider. Once verified, the Housing Authority completes an environmental investigation of the unit with the poisoned child and the associated common areas. When complete, the Housing Authority provides the report to the property owner. If the investigation does not find any lead-based paint hazards, then no further action is required under the lead-safe housing rule by the owner other than to make available to the residents the results of the investigation. If lead paint hazards are found, then the owner has 30 days to complete reduction of those hazards and have the unit cleared by a certified clearance tester. And in the other units, well, let's say the second floor is occupied by a family with children age 8 and 12. The third floor is occupied by a 7-year-old child and his mom who is expecting a child. Because the unit on the second floor is occupied by children 6 years of age or older, there is no additional requirement for another risk assessment for lead paint hazards in that unit. On the third floor, the child is again over the age threshold, but because the woman is pregnant, an age-eligible child is expected to reside there, and so a risk assessment for that unit will be necessary. If the risk assessment shows hazards, they will need to be remediated and the unit cleared. It is important to keep in mind that not every property with multiple federally supported units and young children will need to conduct additional risk assessments. If the owner of the property or designated party conducts a risk assessment and remediates all of the lead hazards between the date the child's blood was last sampled and the date the owner received notification of the elevated blood lead level, then no further action is required. If the owner or designated party can document that all requirements for evaluation of lead hazards, remediation where indicated, lead disclosure, ongoing maintenance, and lead-based paint management for the 12 months preceding the date the owner received the environmental investigation, then they will not be responsible for further testing of other federally supported units with children less than 6 years of age. Finally, let's talk about some of the notification, reporting, and data sharing requirements of the lead-safe housing rule. As in the original rule, whenever a lead paint hazard evaluation, reduction, or now an environmental investigation is conducted, the owner provides notice of such to the residents. Because they are important, additional notifications are required for elevated blood lead level cases. Let's discuss who gets notified, what the notification covers, and then who does the notifying. First is, who gets notified? HUD wants the Public Health Department to be aware of the elevated blood lead level case from the start, so that they can help the child. If someone outside the Public Health Department, who is not a medical health care provider, claims that a child in public housing, project-based housing, or housing choice voucher has an elevated blood lead level, the health department should be immediately notified so they can verify the claim or find out that it is in error. Similarly, HUD itself wants to be notified of the case so we can oversee how the housing is being evaluated and, if necessary, remediated of lead-based paint hazards. Second, what does the notification cover? If the information about the case came originally from a medical health care provider or is verified by one, HUD and the Public Health Department are to be notified of the name and address of the child within 5 days. Then, after lead hazard evaluation or hazard reduction is conducted, the appropriate HUD program office is notified of each of these activities within 10 days after they are completed. Third, who does the notifying? For the Housing Choice Voucher and Project-Based Voucher programs, the owner is formally responsible for the notifications, but the Public Housing Authority can collaborate with the owner by getting information from them and conducting the notifications themselves. This streamlines the notification process because the owner has a relationship with the Housing Authority, and the Housing Authority already has a relationship with HUD and is more likely to have one with the Health Department. For other types of project-based assistance besides the vouchers, the owner conducts the notifications. For public housing, the Public Housing Authority conducts the notifications. Also, under the Tenant-Based Rental Assistance Program, the Public Housing Authority shall attempt quarterly to obtain from the Public Health Department the names and/or addresses of children less than 6 years old who have been identified with an elevated blood lead level. The Housing Authority then matches this information with addresses in the Tenant-Based Rental Assistance Program so that it can start taking action. And quarterly, the Housing Authority shall also share the address information of units receiving assistance with the Health Department so it can start taking action. Okay then, we have covered the major changes to the lead-safe housing rule. Of course, there are some changes we have not touched on, and we strongly urge program staff with responsibility for compliance to read through the entire rule and also the guidance that will come out of your program area. We hope that this was helpful to your understanding of the new requirements, and most importantly, that it will help you as you continue to protect the children and families that we house from the dangers of lead. Thank you for watching.